Is colonoscopy going the way of the dodo bird?
Ah, the dodo. Rhapis cucullatus.
Can a blood test screen for colon cancer? I'm Dr. K from iMedicalSchool. Stick around if you want to learn more about the Shield test by Guardant Health and how it may revolutionize cancer screening. Colorectal cancer is the third most common cancer. Surprisingly, we are seeing more young people diagnosed with colorectal cancer. If you're 45 years or older, you should undergo some type of screening test for colorectal cancer. The methods for screening range from stool tests to a colonoscopy. A colonoscopy is when you're given medications to sleep, and a flexible tube with a camera is used to examine the colon for cancer and precancerous lesions. Unfortunately, there are several reasons why someone may not want to undergo a colonoscopy. These reasons include not tolerating the prep, concerns about risks with anesthesia or the procedure, inability to take time off work, and even access to get a colonoscopy. The only other options for screening are stool-based tests like a FIT or Cologuard. These involve collecting stool samples and submitting them to be analyzed for blood or abnormal DNA. Collecting stool is not exactly a fun proposition.
Oh no.
And can be a reason someone may not use stool tests to screen for colorectal cancer. But what if there was an easier way to screen? Guardant Health developed a blood test called Shield. It is a cell-free DNA test. What is a cell-free DNA test? Well, normally, DNA is stored within the cells of our body. A normal process of our body is for these cells to die and regenerate. When the cells die, their contents can spill out into the bloodstream. DNA fragments that enter the blood are called cell-free DNA, or cfDNA. Sampling the blood for these DNA fragments can help find specific changes in the DNA that may suggest cancer or other diseases. In fact, cell-free DNA tests are currently used to help pregnant women understand if their babies may have genetic diseases like Down syndrome. With cancers, the rapid turnover of cells can lead to abnormal DNA fragments in the blood that can be detected by blood work with a cell-free DNA test. A study published in the New England Journal of Medicine looked at Guardant Health's Shield test for colon cancer screening. It should be noted that the study was funded by Guardant Health. In this study, they looked at 7,861 patients who underwent colonoscopy and the Shield cell-free DNA test. They compared the results of these tests to see how good the Shield test was at identifying colon cancer. The cfDNA test results come back as either abnormal signal detected if abnormal cell-free DNA is found, or normal signal detected if no abnormalities are identified. So how did the Shield test do? Of all the cancers detected by colonoscopy, the cfDNA test detected an abnormal signal in 83.1%. That means 16.9% had colon cancer detected by colonoscopy, but had a normal cfDNA test. You may think that missing roughly 17% is a lot of cancers to miss. But remember that this is a non-invasive screening test, and these results are similar to other non-invasive screening tests. FIT misses about 26% of colon cancers, while Cologuard, a stool DNA-based test, misses about 8%. The cfDNA test seems to perform very similar to most non-invasive tests. In addition, the cfDNA test was able to detect 100% of stage 2, 3, and 4 cancers. For stage 1 cancers, it was able to detect about 65%. However, there were not enough stage 1 cancers to verify whether this difference in detection between stages was significant. We want to catch colon cancer at its earliest stage, or even just before cancer develops. Advanced lesions are polyps or abnormal tissue that carry precancerous changes but are not cancer. Given time, these polyps are likely to turn to cancer. cfDNA detected an abnormal signal in 13.2% of those with advanced precancerous lesions, compared to Cologuard, which was positive in 42.4% of those with advanced precancerous lesions. So what do these numbers mean, and should the Shield test be used for screening? My philosophy is that any screening test that's actually done is better than no screening at all. There are a lot of reasons someone may not want to undergo a screening test, but the more barriers we can remove and catch a cancer at an earlier stage, the better. The Shield test is a non-invasive blood test, so it is unfair to expect it to perform anywhere near to the level of a colonoscopy.
Guy won himself a date with a colonoscopy.
I believe, though, it does do a good job at detecting colorectal cancer that is comparable to other non-invasive tests like FIT and Cologuard. It is important to understand that it does not detect precancerous lesions well. Colonoscopy remains the best test to not only detect colon cancer, but the only test that can help reduce the risk of colorectal cancer.
I'm definitely going with colonoscopy.
I'm excited the cell-free DNA test called Shield will make it even easier to undergo colon cancer screening. Well, I hope you learned something. If you did, please like, share, and subscribe. I'm Dr. K from iMedicalSchool, and I'll see you next time.